Dr. Mike, you're also medical doctor. Can you maybe explain to our viewers how does COVID-19 impact our body, our immune system, if we are exposed and if we get infected?
Well, we've all seen the images, and those who've actually had the disease will know this, that most people are infected through the respiratory route. The virus reaches the nasal mucosa, or the lining of your nose, to use a more term, or the lining of your airways, or the lining of your lung itself. And that lining is all the way along. It's the epithelial lining of the lung. And effectively the virus is adapted to exploit that lining. And the cells for these linings are lined with human cells, and effectively the virus comes along. It's got a protein on the front like a spike, and that spike is perfectly designed to match to and bond with an enzyme or on the surface of the cell, and it's like a lock and key. Essentially, the virus comes in and locks itself in. This enzyme is used for other things. The body uses it for many other functions, but this it's sort of a back door. I mean, most people online will know with viruses they often use these trap doors or back doors to get into the system. That's what the virus is doing. It's almost like a Trojan horse. It comes along and it mimics a protein that the cell expects to see, and it binds. And using that, it's able to gain entry into the cell. And the only reason the virus wants to gain entry into the cell is take control of the cell. Because the virus itself is not a living thing. It actually needs the factory of the human cell to make another copy of itself. It cannot do it itself. So all the virus actually has is this outer wall and these proteins, and inside it's got a packet of genetic material. And once it's inside the cell, it injects that package of material, and it instructs the cell to produce more copies of itself, and this eventually kills the cell. And what happens when the cell is killed, the cell breaks, and the body reacts. The immune system says something's going wrong. There are cells dying everywhere, and it mounts what is called an innate immune response, effectively an inflammatory response. The body reacts to the general alert. There's an intruder present. So first of all, the virus is doing damage because it's causing cells to die, and then the immune response itself can cause some damage because it causes this inflammatory response. The body hasn't learned about the virus yet. The body doesn't know this virus, so it has this innate response. And eventually, over time, in a normally healthy person or someone without an underlying condition, a battle ensues between the virus infecting cells and the body's capacity to fight the virus doing that. And somebody wins. And eventually, in most cases, the immune system wins. We fight off the virus. It doesn't do too much damage. You may feel sick, the lining of you may feel a cough, you may have a sore chest, you may sneeze, because it's really disrupting the function of your respiratory system, but most of us get through that. What happens in some cases is that people's immune systems are compromised for some reason. They're not functioning as well, and their bodies don't react quickly enough, and the virus takes control before the body's system can react. And that's particularly worrying if it gets lower down in the lungs, because that's where you get your oxygen to your blood. And what can happen is it causes a swelling of the lining of the lungs, and that swelling can also cross the lining of the lungs into the lining of the blood vessels. And when that happens, essentially oxygen can't move between the air and your blood. And effectively, that's why people end up on oxygen, why they end up on ventilators, because your body loses the capacity to efficiently transfer. Remember, every moment of your life, when you're asleep, when you're awake, your lungs are transferring oxygen from the air into your blood, allowing your brain and every other part of your function to work. Anything that interferes with your efficient capacity to move oxygen from the air into your bloodstream is dangerous. And that's why this virus causes such severe symptoms, and that's why a good proportion of people admitted to hospital require what we call respiratory support. They either need to have extra oxygen or mechanical assistance in breathing. And in addition to that, if that's not bad enough, the virus can also have effects a long way away from the lungs, and it can actually have impacts on the kidneys, on the brain, on the gastrointestinal system. Some of that is because of the oxygen issue, because these organs like the brain and organs like the kidneys rely on that oxygen, and if that's compromised, they can those organs can fail. But also there's some evidence that the virus can also affect the linings of blood vessels all the way through the body, and in some people that's a very severe effect. So some people don't win the fight, and they end up, the virus overwhelms them. And in a small proportion of people as well, the immune system overreacts, and we've seen a hyperimmune response. So basically the body overreacts to the threat and causes an abnormal amount of inflammation, which in itself can do damage. And we've seen that with some very small number of children who get this hyperimmune response. The child has a normal infection and then 10 days later has this very big inflammatory response, and that actually has caused the death of some children. So our immune systems are strange things. They're kind of calibrated. They've got to react just right. They've got to do enough virus killing to take the advantage over the virus, but cause the least possible amount of inflammation can also damage the human body. And it's a balance, and our bodies don't always get that balance right, especially if we're unhealthy, if we're undernourished, if we're compromised in some way. So therefore, being healthy and having a good diet and being able to, in a sense, absorb the challenge that a virus presents. For a head cold or something, that doesn't matter, because the consequence of that might be, well, if I'm not that healthy, maybe I have the head cold for an extra day. But in the case of COVID, this can become a life and death battle for an individual. So that's how the virus operates, how it gets in. It's a very simple process, but it's amazing how such a small packet of genetic material has caused us such trouble. Anyway, I've probably over-explained it now. I hope I haven't confused people, but it is important for us to try and understand that we're in a dynamic balance with nature all the time. For example, if you were to take a swab in my nose now, you'll find bacteria. Some of them are pathogenic bacteria, and I could be infected by them, but my innate immune system is effectively always on alert. It's all, and all of these linings of my lungs and other places are constantly maintaining a balance. And we've heard that with, when people are taking these drinks to try and manage their gut biome. Well, there's a biome also in your respiratory tract, and there's a healthy biome, and there are healthy organisms that are in a dynamic sort of balance with your immune system, and that's an ecosystem. And what viruses do is they come in and they rip through that ecosystem because they've only got one thing in mind, that is to infect as many cells as they can infect and to force that cell to produce copies of themselves. For those people who are fans of Star Trek, they're the Borg of the natural world,